as you heard, nurses and healthcare workers are the ones at greatest risk for Ebola exposure.
So how do they deal with the risk of infection, and what's being done to prepare and protect our frontline defense?
CBS 2's Dr. Max Gomez spent some time in an ER today. Doc.
That's right, Maurice and Alice. I went to the Lenox Hill emergency room and was able to quietly observe. Everyone who walked in the door was immediately asked if they felt feverish or were running a fever. There was a dispenser on the entry wall that said if you have a fever, rash, or cough, grab a face mask here and put it on. Here's what else is being done. It is the doctors, nurses, and technicians at hospitals who are by far the most likely people to encounter an infected Ebola patient.
Most everyone at this point is very calm. There's no sense of panic or fear. We know that those most at risk, again, are healthcare workers with close contact, but we have protocols in place.
But as we saw in Dallas, having protocols and making sure they're followed can be two different things. So today, health officials and politicians in Nassau County announced plans to make sure healthcare workers are adequately trained and equipped to deal with possible Ebola patients. Other groups and hospitals in the area are also holding training and education sessions this week, especially proper isolation techniques.
It's not an easy protocol to follow, meaning that, it requires many steps, putting a gown and gloves, a face mask and shield on.
But what about doctors' offices? At the Juva Skin and Laser Center, dermatologic procedures potentially expose staff to bodily fluids.
In the back of your mind, because of all the scares and the media and the hearsay, you kind of get a little nervous.
And with the United Nations here, New York City is a hub for diplomats from around the world.
We do have a lot of international travelers, so we're always looking to make sure that there's nothing that looks unusual, they look feverish, or they're coughing.
Bottom line is that there are still only 2 cases of Ebola contracted on U.S. soil, and both are nurses who came into very close contact with the deceased Ebola patient and his bodily fluids. Now, the bottom line is that it is not easy to get Ebola. It requires close contact with blood, vomit, diarrhea, other secretions. And even then, there has to be a route of entry, an open sore or cut or rubbing the nose, eyes, or mouth. Ebola is not airborne.
Oh, boy. The more you talk about it, though, the more people get sort of, But all this in context, what is the risk to the average person who walks into the ER or the doctor's office?
You can never say it is a zero risk, but unless you come into contact with those infected bodily fluids, the chance of contracting Ebola is as close to non-existent as you can get. And the Dallas Morning News report that nurses taking care of the Ebola patient there did not wear hazmat-type protective gear explains how they likely got infected. Mr. Duncan was reportedly spewing bodily fluids, and the nurses were unprotected. So it's not a surprise that this happened. On the other hand, it means that perhaps dozens more people may have been exposed.
Wow. Okay, we'll stay posted. Dr. Max, thank you.
And we have much more information on Ebola on our website. That includes facts about the disease, travel tips, and safety information. Just head over to cbsnewyork.com.